is a doctor in emergency medicine at University College London, and she will present a presentation about artificial intelligence.
Hello, and thank you for the introduction. As was mentioned, I'm an A&E doctor, but I also am doing a PhD in artificial intelligence and the impact of technology on patients. And I'll talk more about the impact of technology today, less about the AI. One impact of the COVID-19 pandemic was our increased reliance on technology, and with that, an increase in technology-facilitated abuse, or tech abuse. I'm going to talk about what tech abuse is, how it affects our patients, and why it's relevant to us as practitioners. So tech abuse refers to a range of different phenomena, which can be online or offline behaviours, from GPS tracking to online harassment and cyberbullying. A few examples here. So e-surveillance refers to electronic surveillance, which is the use of malware to monitor activity, look at messages, listen to voice conversations, use GPS tracking. In the domestic setting, this is called spousal spyware, and we also see in the domestic setting the manipulation of smart home devices in order to cause harm. Deepfakes and image-based abuse are an evolving area of tech abuse and have high risks of suicide and mental health impacts. And then biohacking and cybercrisis is a very novel area which describes the manipulation of implanted medical devices to cause harm. So, for example, telemetric pacemakers or insulin pumps. We can already see at this point how this might impact on patient care. So if you have a patient who has e-surveillance malware and you're trying to have a conversation with them, if their technology is voice activated, so it streams all of the conversations that they're having around the device, it has implications for patient-doctor confidentiality. This is an example just to demonstrate the evolving market of these technologies. So they're becoming more accessible, they're becoming more available. One of the most common apps is called Track My Wife, which allows you to put malware on a phone, monitor messages, interactions, conversations, etc. But it's not just at the point of consultation and issues of confidentiality that affect patients. We see the impact of tech abuse all along the patient journey. So from the point of patient consultation, there have been different examples of this. And referring back to the smart home manipulation, we've seen cases in domestic violence where smart locks have been used and remote thermostats have been manipulated to impose extreme heats of temperature to cause injury to a patient. Also in the case of domestic violence, using remote sound systems to blare music during the night, change the lighting, and create different forms of harm. In terms of biohacking, in America there's been the exploitation of telemetric insulin pumps and demonstrated how by exploiting these cyber vulnerabilities you can deliver lethal doses of insulin. And then on the online world, Epilepsy Support Forum was hacked by malicious hackers who then created a series of flashing images and induced seizures in epilepsy patients who were looking for support online. So there's a huge range from sort of the Internet of Things and smart home devices to our online experience on websites. When we get to the hospital, these problems don't go away, considering the interconnected nature of everything. So we've seen in hospital settings that GPS tracking has been used in paediatric cases, where we've had patients exposed to gang violence, and then GPS has been used to track them in the hospital where people have tried to escalate the harm. Again, in the case of domestic violence, survivors who presented to the hospital have been referred to refuges. GPS trackers have been found on the children's toys who go with them, and prams, and these are kind of small little trackers that get added to clothing and different things. And then when we discharge a patient to their home, we need to reconceptualise our idea of what safe spaces are. So when you're discharging someone, if they're going to be in a space of electronic surveillance, smart home devices, is that now a less safe home than what we would have considered a traditional home environment? So what are we doing about this? We're doing a research project around the UK, and this is based between University College London, which is where I'm based for my AI work, and different A&E departments in Nottingham, Manchester and London. And we've been running focus groups with safeguarding practitioners who work with either victims of domestic violence or children exposed to youth violence to find out what trends that they've been seeing in the field of tech abuse. We're looking at the safeguarding guidelines that they're currently using and seeing if it looks at digital risk factors and analyses the digital history of a patient. And one thing we saw from these early focus groups was practitioners saying that they are yet to meet a young person who isn't affected by tech abuse in some way. So some of the findings that we've already had is this developing idea of best digital practice and how can we incorporate this into our typical assessments of patients. One of the first issues the practitioners raised was the vulnerable groups which are affected by tech abuse. And adult and paediatric patients seem to be affected very differently. So for adults there is often a lower digital literacy, and in domestic violence or abuse situations this materialises as malware or spyware being on a phone and the adult not having an awareness of this or not knowing how that affects their risk of harm. For paediatric patients it's often the opposite. They often have very high digital literacy and they're often quite a few steps ahead of the adult population, but this means they're able to get around cybersecurity defences, access online websites, access spaces like the metaverse, which can come with these additional risks that adults aren't aware of. Additionally, minoritized groups tend to experience more tech abuse and online harm, so racial minorities, religious minorities, LGBTQ populations, and so groups that are already at risk of increased harm, increased mental health risks are being further targeted by this technology. In terms of conceptualising risks, when we look at mental health assessments, we often consider how high a risk of suicide or self-harm a patient is. A lot of this tech abuse stalkware is related to a much higher risk of these outcomes, whether that's homicide in domestic violence or youth violence, or suicide in the case of mental health. And yet we don't collect any information on digital risk factors, whether someone has smart devices in place at home, whether they're accessing certain online forums. Additionally, we rarely ask about the implanted medical devices in a digital history, and given the increasing concern about hackable medical devices, asking whether someone has an implanted sensor for glucose monitoring or a telemetric pacemaker, etc., is something that needs to be integrated into medical history taking. Safe spaces, again, refers to smart homes, but also the hospital and school environments. Because we now live in this interconnected world, it's very difficult to find a space where you're protected from tech abuse, and that can also heighten patients' feelings of fear and risks of harm. And then gaps in the guidelines, it's been very clear from every focus group so far that none of this is captured in our traditional safeguarding guidelines, but also it's not reported in metrics. So we don't have a way of tracking these things and seeing what the prevalence is. And so the next steps in our work is to try and redevelop these guidelines, introduce digital risk factors, integrate digital history taking into the social history that we often take of a patient. So those are my details. If you're interested, if you would like to look at doing this in your own hospital or follow our research, please get in touch either on Twitter or by email. And I thank you very much.
Thank you. Amazing. There are spiders everywhere. Last speaker. L'Ariel. L'Ariel told me to say he's only the founder of a medical post, and he will introduce his vision in first responder in the world.
Howdy, y'all.